Hello, everybody. Happy Friday and welcome to my show. Thank you very much. I know I missed last couple of shows, and but today is a very happy Friday. It's a long weekend. I'm sure you must be looking forward for an amazing Memorial Day weekend. Friday, Saturday, Sunday, Monday, all 4 days off. So fantastic time for people who are looking ahead to spend some time with the families, or if your kids are coming home, this is going to be a fantastic weekend. So today I am talking about my favorite topic about patient collection. And there is a study which has come from MGMA, which I'm really excited about to share some of those results and the data. But before we go to our favorite topic, I have a huge announcement to make. As most of you know, that I'm associated with HPMA in a volunteer position, and I'm one of the directors, board of directors. HBMA, Healthcare Business Management Association. We are coming up with our fall annual conference, and which is happening in JW Marriott, September 26 to 28. I have Executive Director of HBMA, Brad Lund. He is going to be with us and he's going to explain us what we have, what are the topics, what are the session, what are the description of those sessions, who all are the speakers, all of those good stuff we are going to talk about in next few minutes. So let me introduce you, Brad, right here. Hello, Brad. How are you doing?
I'm good, Kunal. Thanks for having me on this
Absolutely.
on the start of the long weekend that you talked about. It's so good to
I
be
know
here.
it is, everybody is excited. So I don't know how many people are going to attend, but a lot of these people watch our show again, and I think we are posting it at HPMA also today. So a lot of our membership is going to watch our show.
Yes.
So thank you very much for joining at the last minute. I know I just sent you an email an hour ago.
Well, I got the email and I was so delighted that you invited me because I always want to talk about HBMA. As you know, Kunal, HBMA is the Revenue Cycle Management Association. That's what we
Right,
focus on.
right,
And we've got our national conference coming up this fall, as you said,
right,
September 26th to the 28th. We're at the
right.
JW Marriott in Indianapolis, and the Indianapolis Colts are not playing that weekend, so we don't have to share the city with the Colts. Um,
Let me show you some details about it. Here it is, so that people know. I took a screenshot. You can see it?
well, I can
I
see
think
it.
everybody can see it.
Yep,
Perfect.
that's it.
Let's
That's
talk about it. So what do we have on? So tell me a little bit difference about different conferences we do. I know we were talking about earlier on innovation, and now in September, from September 26 to 28, HBMA is an association for mostly healthcare business management companies, right, in the United States.
revenue cycle management, mostly, yes.
Revenue cycle management companies. Now, tell me about this conference. The dates are 26th and 28th. How do they go and register for it?
At www.hbma.org,
Okay,
and
so
on
that is our
the
website,
that's our website.
www.hpma.org. Okay, are there any deadlines they have to cost deadlines?
Yeah, the discounted registration fee ends on August 11th.
So August. Okay, so we have couple of months. We're giving them enough notice, and it's about $800 for members, and it's about $1,000 for non-members. And
Correct.
then you can invite your guests. It's about $600. All registration is online. You can see the session description. Like particular one session, I'm very excited about, where we would be talking about actually patients and patient billing and collecting AR, and that is the topic I have today, where I am going to talk about at our conference. So do you have to share anything else? Do you want to talk about any keynote speaker or particular speaker you're excited about?
This conference is designed with the revenue cycle management leadership in mind. We have two tracks. There will be very few general sessions. Mostly, it's going to be tracks of education. So we've got an executive track and we have an administrative track. And so you can choose one or the other for the most part. We've got a number of great sessions. You're doing one for us
Yes, I'm doing
on
one session. Yes,
outsourcing
about offshore outsourcing.
offshore,
Yes,
which is a very big topic for the revenue cycle management company, and also some practices obviously use the outsourcing opportunities as well. We've got a couple of sessions they're going to focus on AI. First is going to be AI integration, and then we're going to do an AI to reduce revenue leak. And there's also a session on robotic process technology. So we're really jumping all over the booming world of AI. We've got sessions on compliance. Um, Two of the senior people from CAQH Core are going to be there, and they're going to be talking to us about the operating rules. And we've got a very exciting session. We've invited the commercial payer industry to join us. And so we have a session that Aetna, Cigna, and United Healthcare are all going to be presenting various advances they've made to help in the revenue cycle management process. We've got another, benchmarking is really important for the senior management of a revenue cycle management company. So we've got a session that we call Reimagining the Approach to Benchmarking. It's a whole new way of looking at benchmarking. And of course, we've got coding and compliance, which is very important to us. And finally, we've got a great session on negotiating managed care contracts. That's a big one. So there's something for
negotiating
everybody
managed
here.
care contracts. Yes, I
Yeah,
know most of our physician friends, they would love to hear about those things, and billing companies. These are the hot topics. Absolutely. I mean, see, sometimes people don't realize how important is education, and especially this is the underlying mission of HPMA. So I really like that part, that we still wants to empower medical billing companies, revenue cycle management companies, and indirectly, basically, we are helping physicians and practice managers and
sure,
practice
sure,
managements and all.
sure.
So this is a fantastic goal.
And Kunal, one thing that's overlooked at conferences like this is the exhibit hall.
Right.
Most people think of the exhibit hall as where you go for breaks and lunch, and in the evening you go for drinks and food. Uh, our exhibit hall will have 60 different exhibitors. When you
60
look at
different,
that,
60. Wow.
60. So that's the opportunity where you can go all at one time over the course of 2.5 days, and you can get so much information about what's happening, what companies that are out there that can help you become more efficient and effective. That's a great resource at Exhibit Hall.
Oh, believe me, I have used so many vendors in last 10 years. I met them in HBMA exhibition, and that was a fantastic experience. Like, you can pick up merchant account services, you can pick up new, innovations. There are all kind of booths. I mean, I have met people who are showing up new products, new EMRs, new solutions for billing. I love it. Our exhibition hall is full of innovative companies. It's a fantastic platform for anybody who wants to come up and who was facing, there are people like physicians and billing companies facing some issues, and they could not find where to find the, answers. So I think our exhibit hall is a perfect platform, or a place to find answers. So I love it.
Absolutely. And finally, I've got to say that if you come, you want to stay for Thursday night. HBMA is celebrating its 30th anniversary, and we're going to throw a gala party on Thursday
Party
evening.
time.
We're going to have we're going to have open bars. We're going to have lots of food, and we're going to have a band just in case you want to dance.
Here you go. That's the perfect, and that we all love that. So,
Yeah,
and that's a
absolutely.
Thursday night. So Thursday night, Friday night, and Saturday, and you can leave Sunday for
Oh,
your
oh
families.
no, it's actually Tuesday, Wednesday, and Thursday. The
Tuesday.
party
Okay,
Thursday night is the
Thursday.
end of the event.
Perfect.
Yeah, and Kunal, I've watched you at these national conferences, and you are probably as big of a networking person as anybody. But you find that to be very valuable to be able to sit
It is.
across the table from your
Networking is
colleagues.
great in our
Network,
conference.
it's just terrific.
Yes, it is terrific. Last time we met so many friends, and it's not like people who wants to hang out there just by themselves. I find a lot of people bring their families, and
Yes,
they just enjoy. Even the guest fees is like just $600, so you can bring your spouse, partner, and is a great kind of Deal, you enjoy 3 nights, and I think all lunches are taken care of. In the
Yep,
evening, we have two receptions
yep.
and a lot of good educational material to empower your business. So it's a full package.
It's a full package, and our hotel is right next to the NCAA national office, so you can go over and see all kinds of information about the National Athletic Association.
Well, fantastic.
So
Thank you so much. And I will let you go. I know you have to go. You told me you came at the last minute. So thank you very much. And we'll talk more when we meet at HPMA.
great. Thank you so much, Kunal.
Thank you.
Goodbye.
So this was, so thank you very much. That was Brett Lund from HPMA. And today we are going to start our session soon. I have prepared so much for this session because this is my favorite subject. And I'm going to talk about two things today. You know how all these patient collection efforts in a medical office, what is the purpose of it, right? How does it really matter, you know, when why it is so important to handle patient calls and patient interaction smoothly? And I tell you the reason is customer service. If your doctor's office, if they think that we are a doctor's office, we see tons of patients day in day out, and customer service is not very important for us, we are missing a point here. If we do not satisfy or answer our patients' collection calls or collection related issues smoothly and convincingly, then we are sitting on a bigger problem. And the bigger problem is I'm going to show you a lawsuit which has happened. I just got this from, if you see, there's a company of 10 physicians, they agree to pay $2 million to settle False Claim Act liability. You won't even find only the malpractice suits happening around you, but more than malpractice suit, you will find even the regular lawsuit. Even the patient is not happy, he's disgruntled. He's going to find an attorney who is going to file a lawsuit against a medical practice. And guess what? That lawsuit can go anywhere. It can come on different direction and it can hit you and it can make you pay millions of dollars. So your first and foremost mission for the medical practice should be extremely good customer service. Handle your patients very smoothly and in a very patient friendly environment. So with that, this is the problem. Now, how we are going to diagnose this problem, right? The most important question you have to understand when people ask is why this happens. So here is I'm going to give you a prognosis for this startup problem. And the prognosis is, majority of people, if you are going to talk about, prognosis comes from the data. 30 to 45% people in a medical practice, they says it takes from 120 days and plus. 40% people say more than 120 days it takes to determine what is patient responsibility in a medical practice. Because you go, you give your card, you have an insurance, and most medical offices do not charge you money unless they get a EOB from a doctor, from an insurance company. And the reason for that is they are not confident that the money which they are charging, it is the real money, it is the amount which you contractually owe, or it is just a guesstimate. So that is a huge opportunity for anybody to develop some kind of solution or innovation in that particular area. The accurate estimation of patient responsibility is a huge area, huge gap where people or doctors' offices, healthcare groups, medical practices, they need help. So this is the problem. Now we're going to talk about what are the guidelines. What do the public policies say? How does it collected in today's world? Well, in a real-time scenario, for any outstanding, doctors' offices make calls. or send, when the patient comes, they try to explain to the patient that you owe such and such money, this is your copay, this is your coinsurance, and this is an estimated amount, and insurance company has a final say so how much you owe. So based on the amount of deductible coverage or money you are responsible, coinsurance is required. So all of that conversation happens either before your patient visit, or once you receive an AOB, or doctor's office receives an EOB, then you get a call from a doctor's office. In both scenarios, this process is extremely lengthy, extremely complex, and it is not clear in a very transparent fashion how much a patient owes. And that's where the confusion arises. So most patients has a questions, and most patients ask very common questions. And okay, I paid the copay at the time of service. Why do I need to pay again? And then you have to explain them the difference between copayment, coinsurance, or patient deductible. Now, then patient will ask, okay, this is I have met my deductibles already in the insurance company. Now, if you do not have a technology or you don't have that information in front of you in the computer, you won't be able to provide answer for that question. So the doctor's contract with the health plan, it provides a one fixed fee for each service. You have to understand it. And then it is set by the plan. Now, if doctor sees hundreds of plans, there are hundreds of plans, there are hundreds of different ways of calculating the fees. Now, the best practice in this scenario is when the patient comes, most busiest practices they charge an estimated account amount from a patient. And if the patient and a doctor's office has a trust which is built over a period of time, they would be able to explain it to the patient that okay, this is you pay $200, and do have if we are not getting enough, if you don't met your deductible, then this would be adjusted against your deductible. But if you would met your deductible, then we are going to refund your money. In both the scenario, again, this is kind of not a very clear transparent rule. So what happens in that scenario? So there are two scenarios you can talk about: patient versus priorities for your staff. Just think about it. You have a patient, you would be talking to the patient, or you have other priorities in the office where you have to take the patient inside the office, you have to see the patient, you have to do the clinical visit, and all of those things. So in both the scenarios, the staff has to prioritize. Now, there are some things which I have been, you know, seeing at a different way. Like you saw that there is an exhibition hall in HBMA, or you go to different conferences, you network with people, you find what other people have developed different type of solutions. So the traditional way of calling patients has been always phone calls, right? You always call the patient, talk to them, explain it what it is. But there are so many mistakes which a doctor's office do while handling patients at that time. And I'm going to touch upon a few things what doctor's office do these days. So if you are creating, let's say you are giving a receipt to a patient, and then sometimes you are on a phone call and patient says, hey, can you email me the receipt? Now, think about it. As per HIPAA guidelines, you cannot email, especially unsecured email, to your patients if their name is written on it, if their code is written on it, or and if it is a receipt and if you have the code that shows it's a HIPAA violation. So you have to be very careful. You have to know what you really can do or cannot do as a patient advocate. Somebody asks, can we send a receipt through email? No, you cannot. And then somebody also asked here, can we collect a payment over the phone? Yes, you can collect the payment over the phone, but you cannot write credit card number on a piece of paper and then trash it somewhere. That is also out of compliance. So you have to be very careful. So here is the solution. Here is a perfect solution which has been coming into the practice, but not quite often. Most practice management solutions, if you are using like an EMR like eClinicalWorks, Advance MD, or any kind of EMR you are using, Find out if they have an inbuilt merchant account service. If they have an inbuilt merchant account service, that is your best bet to keep all of your credit card information from the patients in it, because it is safe, it is secure. If you have that facility, talk to your practice management company or EMR company. Or if you have a billing company, talk to them. Now, a lot of that time, what happens? A lot of times you think, oh, it is, I have to change my merchant account to a different company. It is okay. You can have multiple merchant accounts. You can have multiple merchant accounts, and all of those accounts can be linked to your bank. So you can have a merchant account through your bank, and they have given you the, point of sale credit card machine. Or you can have a merchant account where you can have, which is inbuilt, and you can ask your patients, or even your billing company can keep the credit card information securely in your practice management system. Number two, instead of calling, start using text based services or patient portal or mobile solution. All three are linked with mobile. So it has been, people have not been practicing that. A lot of these medical practices find technologically very challenged. Talk to your computer guy, talk to your biller, and see if you can integrate, or you can find an integration with your existing practice management system where you can send a text from your practice management system to the patient's mobile phone. That is the best way to send notification alerts, their balances, and it is perfectly safe because most text based services, if it is integrated in your practice management system, it is secure, it's HIPAA compliant. So ask your billing company or your EMR company to test text based services. So, texting is very important. Number two, even if you don't have texting capabilities, start using Patient Portal. Because Patient Portal, what it does is it sends a secure email to patients within the portal, and he can pay the balance within the portal. Now, there are two ways to handle this. One is just an alert that you have a balance and you have to come back and pay in the office, or you can send a balance link within your patient portal where your patients would go online and pay it. I would always suggest later. So we talked about mobile solution, we talked about text-based services, we talked about merchant services account integrated with your email or with your EMR or practice management system. Third thing, and that is the most important thing, see if you can use some kind of online payment, online insurance adjudication tool like a Validity to find out whether the patient has met his deductibles or not. If you have that tool, you would be able to find out that you can charge the patient exact and accurate amount before his visit. I'll give you an example, and it's a very, very simple example. So let's say uh, the first step is to collect more of the co-payment and non-deductible. So co-payments are easy. It's written on the card. You owe $50 for PCP. So let's say most practice codes, a new patient visit, they do a level 4 visit. Medicare pays roughly $165, and most health plan pay a percentage of this. Generally 75 to 90%. Medicare pays 80%. So out of 165, if a copay is, let's say, $15, $25, plus $20, 20% is the co-insurance. You can exactly identify how much in your practice management system or a billing system, it can give you exactly how much a patient owes, and you can actually charge that amount. So there is a clarity right then and there. Similarly, if you have some other plans like commercial plans, PPO plans, or HMO plans where you know exactly what is your fee schedule, and if you can load your fee schedule in the system, again, and that changes every year. So every year you have to change your fee schedule, and you have to put the co-insurance details right there for each patient. So when a patient arrives, you put the patient information there, and if you put a co-insurance and put a deductible there information, it should match, and it should give you exactly how much you need to charge from the patient, and it's called pre-adjudication. Now, all of this can be outsourced. Pre adjudication of the payment is a huge deal. If your office is not comfortable doing this, you can outsource it to the third party. A lot of these third party companies, like ourselves, we started doing pre-payment patient adjudication. What that means is, in 24 hours in advance, we would send a message in your system securely, and as a note, that this patient is arriving tomorrow, but you have to collect this much money from that patient. So that way, you are 100% confident that how much money you this patient owes, and you can, ask the patient to pay that amount before the visit. So we talked about three important things today. What is the problem? Problem is grave. There's a lot of opportunity for startups to innovate, and it's not we're not talking about the insurance collection, we are purely talking about the patient collection. So patient collection at the point of care is a huge challenge, and even post patient visit, collecting patient portion or patient payment is a daunting task. So we talked about the problem. We also talked about that it can lead to potential lawsuits, which can come after your practice in a different ways. Then we also talk about what things you need to do or not to do, like HIPAA compliant. It is very important, even if you're a smallest doctor's office, one doctor office, one girl, or one person at a front desk. You still need to follow the HIPAA rules. You never know who is watching you. And what if the patient leaves and complains to somebody, and that person comes after your practice? Don't send emails to your patients. Unsecure emails are bad. um, Explain them well the difference between copays and co-insurances. Do not discuss any personal matters or anything else about the patients, even if they trigger you, talk to you about different things. Do not do those. What are the guidelines, payer guidelines? And if you have exact payer guidelines, fee schedules, load them into your accounting system, or EMR, or medical billing system. And then I gave you about three different tools which you should immediately start using it. Most good EMR companies, they have started providing you text-based services, so you can text to your patients, patient portals, use patient portals, change the merchant account in your office, and start using or collecting credit cards in advance for patients. So if patient is not ready to pay $200 as an estimated payment towards his care, ask them to leave the credit card in the system, and tell them it is perfectly secure. Um, Keep the credit card, and when a EOB hits, and if there is a deductible for only $50, you charge the $50. So merchant account, texting, patient portals, and collect every penny if you can before the patient arrives. So, this is what we had today. Patient AR is a huge opportunity to innovate. There are a lot of opportunities here. I would continue to talk about those opportunities. And please keep watching my Friday shows. Thank you very much. Have a great Friday. Have a wonderful Memorial Day weekend. And we will see you next Friday. Until then, thank you very much.